Hi, I'm Lisa from the office of the European Doula Network, and today I'm going to be having a chat with Lindsay Gale, who's a doula in the UK. She's moving to France next month and she's coming to help us in the EDN office, which is wonderful. So Lindsay, if you'd like to say a bit about yourself.
I'm Lindsay and I'm a doula in the UK up in Yorkshire in the north of England, and I've been doulaing just for 2 years, and today we're going to talk about my experience using Reboso in doula situations.
Okay, and this is really following on from what we heard from Deborah and Bridget, and also we're going to be hearing from Selena as well, thinking about the doing and being elements of being a doula. And so I know that you've had a couple of experiences recently and a few things that were kind of relevant to this whole discussion. And yeah, so if you want to start by sharing with us the birth that you attended recently and the Reboso was involved.
So I attended a birth a couple of months ago, and the client was labouring very nicely in the dark in a pool, and I was doing what I normally do at births, which is just sort of sit to one side of the pool. I was actually knitting at the time. It was nice and dark and everything was going fine, but it was quite a stop-start kind of labour. There was no pattern to it, and it got to the point where my client was getting very tired and very frustrated that nothing seemed to be happening, and she decided that she would like to have a vaginal examination to see if there was any reason why things weren't going quicker. She'd been labouring for about 18 hours and there didn't seem to be any sort of notable signs of any progress being made. So she asked her midwife, who she'd known throughout her pregnancy, to do an exam. And when the midwife examined her, she was 5 centimetres, just 5 centimetres dilated, 4 to 5, and the midwife noticed a positional problem. So the baby had a brow presentation, but also a slight tilt to the head, and the baby was also back to back. So obviously this wasn't great news for the client. She was very upset about this and sort of didn't really know what to do. Outside of the birthing room, I spoke to the midwife and her second midwife, and she said that she had never seen a baby in that position be born vaginally at home or born vaginally in hospital without some kind of assistance, and that they would be starting to set things in motion for a transfer into hospital, which was obviously really upsetting for my client to hear. And I asked at that point if there was any if I could try and help the position with the use of the Reboso and some movement. And the midwife said there was absolutely no problem to go ahead and do that. So I discussed it with my client and said, look, this is the options. We can have a go with the Reboso, we can try some movements and see what happens. Are you up for that? And basically she said she was. So we did a few different Reboso techniques. We did some movements, like yoga type movements. And to cut a long story short, within 2 hours from that vaginal examination and the midwife saying there's no way this baby's going to be born at home, the baby was born on her living room floor. So she'd gone from 5 centimetres to having a baby within 2 hours after the use of the Reboso. So that was a success story from a doula doing something at a birth as opposed to being.
Yeah. And then you also had a couple of conversations subsequent to that just really linked into this whole discussion really, that were quite interesting. I know one was with another client's husband.
Yeah, so my next client after this was also planning a home birth, and we were discussing the role of the doula at the birth, and her husband was very interested in what a doula actually did or didn't do, and he'd done a lot of research himself. He was a lawyer and he was very into the fine details of what everybody's roles were. What were the midwives doing? What were the doulas doing? What would he be doing? And his wife brought up the Reboso and said, you know, what could be done with movement and Reboso and positioning? Should there be a positional problem at birth? And he just stopped for a moment and said, so hang on a minute, if we start using the Reboso, doesn't that mean you're going from a being role to a doing role? And that I had to agree that that was correct. And he said, well, what happens then? Do we have to sign a consent form to say that we agree to you actually physically doing something? What happens if something goes wrong? Can we sue you? Are you insured? Etc, etc. And this started making me think, well, hang on a minute, where do we stand as doulas? If we start physically doing something, we actually use a reboso, we actually direct women to do something physical, and something did happen that then they say, well, actually it was her fault, she isn't medically trained and she did this and whatever happened. So this started us thinking about, well, where do doulas stand when it comes to starting to do things physically with a client?
There's definitely a grey area.
Massive grey area.
Definitely a grey area. And for example, also there was another scenario recently for you with a client that had meconium stain.
Yeah, so my last client had a similar experience to the client I was talking about to begin with, who had, it was her second baby, she was having a home birth, and again, similar stop-start kind of labour. When she was examined, the baby was in an awkward lie. However, meconium had been present about half an hour earlier, and the midwife was concerned about that, and she was planning a transfer in, but the client said to me, can you not use the reboso? Can you try and do something with the reboso to help with a positional problem? And I declined to do anything because of meconium being present and not having enough knowledge about that to decide whether it was safe for me to use a reboso. And I said that I wouldn't, much to the disappointment of the client. So again, it's feeling like you letting somebody down when you have those skills to use the reboso skills, but not having the sort of medical knowledge to do that.
Do you think that the reason that you felt that you should decline at that point was as a result of these other sort of thoughts that have been going around about
definitely
where things would stand legally if then some worst case scenario happened and there was more distress or something like that caused with the baby, and then perhaps there was a poor outcome of some description, and there was a chance that maybe somebody would look to you and say, well, perhaps that impacted on it.
Yeah, definitely. And certainly once the client, whose husband was a lawyer, discussed it with me about, where do doulas stand legally, that sort of made me think we really need to talk about this as a team, as EDN and Doula UK, to work out what is the role of a doula when it comes to the more hands-on things that we sometimes offer.
So I think that also is part of one of the other things we're going to be discussing, which is the unified sort of definition or code of ethics in terms of defining what the role of a doula is. So thanks for that. That's some good food for thought. Okay, thank you.